Here's what you need to know this morning. Toddlers COVID unusual. Professor Booy says COVID-19 is not a disease which often s children. The of a Sydney toddler from COVID-19 has been described as very rare by an infectious diseases expert. NSW health authorities said the 2-year-old Western Sydney boy was previously well. He at the Children's Hospital at Westmead after being diagnosed with the disease, and was one of 4 people with COVID whose S were recorded in the state yesterday. The others were aged from their 70s to their 90s. Infectious diseases pediatrician Robert Booy said the most children under 5 who got COVID-19 had mild symptoms or none at all. Professor Booy reassured parents that S in this cohort were uncommon. So this is the disease of older people, of people with chronic medical problems, he said. It's not a disease which often s children. It's very rare. Nurses to vote on strike action. The Nurses Union says there has been little progress in meeting its demands since a strike in February. NSW Health Minister Brad Hazzard says efforts are being made to resolve the issues raised by the Nurses Union, which has threatened another strike next week. It would be the second in as many months, with nurses to vote this week on whether to take the action next Thursday. The union's Brett Holmes said little progress had been made since the last strike in February, and there was no indication the government was listening. The union is calling for better pay and conditions, and changes to understaffing levels. However, a spokesperson for Mr. Hazzard said he had been communicating with the union boss, including as recently as the weekend. Each of the areas raised by the Nurses and Midwives Association has been discussed and work is continuing to try and resolve the issues, they said. Rise in COVID cases a concern. The AMA is concerned over the rise in COVID-19 hospital admissions. The growing number of COVID-19 patients in New South Wales hospitals is concerning, the Australian Medical Association says. Yesterday, there were 1,163 people in hospital, including 34 people in intensive care. That compares to just over 1,000 people in the hospital system over a week ago. NSW AMA's Michael Borning said while intensive care numbers were staying low, the hospital system was under strain. Because of ongoing staff furloughs, some of these cases are within the family, so either the children or partners of healthcare workers, or healthcare workers themselves, he said. That, with increasing hospital numbers, does mean that we end up with stretch being placed on our hospital system. School demountables in the spotlight. The Federation of Parents and Citizens Associations is calling for an urgent review into the use of demountable classrooms. Concerns have been raised about the number of newly built public schools in New South Wales relying on demountable classrooms. The state's Federation of Parents and Citizens Associations raised the issue in its submission to an upper house inquiry into school infrastructure. It said new schools in Western Sydney, as well as those in Armidale and Ballina, were relying on demountables within years of opening. It is calling for an urgent review into how the NSW Department of Education forecasts population changes. The state's Auditor General has also lodged a submission, saying reviews into the planning and delivery of school infrastructure were done in 2017 and 2021. The inquiry received more than 100 submissions, with a final report expected in October. Missed opportunity to reform Social Security. A new report says the withdrawal of income support is among the factors driving the housing and rental crises. The federal government is being urged to overhaul the Social Security and private rental sectors to help tackle the national housing and rental crises. The University of New South Wales and Australian Council of Social Services have released a report showing regional rents have soared by 18% during the pandemic, partly driven by people's desire for homes rather than apartments. The report also blames government cash grants to build residential properties. UNSW Professor Hal Pawson said the withdrawal of extra income support had also played a major role. Just reverting to that after the pandemic, I think it's a missed opportunity politically, he said. Putting in place the coronavirus supplement, doubling job seeker payments for a period of time was a very insightful response. That's an overdue reform, which a lot of economists would agree is something which Australia should be contemplating anyway. He said Australia had one of the lowest rates of social security payments among OECD countries.